बढ़ता गया जोर दवा की, मर्ज बढ़ता गया जोर दवा की। अब पश्चिम बच्चे कल बोले
मैं अपनी ग्रांट पे दे दूंगा तो इसकी परमिट
दे दीजिए आप,
ठीक,
आप भेज दीजिए,
चले दे दे आप लिख के दे दे,
आप दे दीजिए, रिटर्न में दे दीजिए, मैं देखती हूँ, कोई बात नहीं। सर मैं आपकी शुक्रगुजार हूँ और जितने सारे ऑनरेबल मेंबर्स ने यहाँ पे इन 3 डिपार्टमेंट्स में अपने अपने सजेशन रखे हैं, अपनी अपनी राय रखी हैं, और जो नहीं बोल पाए वक्त की कमी की वजह से, मैं उनको यकीन दिलाना चाहती हूँ कि वो ज़रूर लिख के दे दीजिए। जैसे ऑनरेबल एमएलए साहिबान ने बात की है यहाँ पे, मुझे रिटर्न में दे दीजिए, फिर जो भी मुमकिन होगा मैं उसको ज़रूर करने की कोशिश करूँगी। और जिन 19 लोगों ने 17 लोगों ने कट मोशन के ज़रिए अपने बात, अपने सजेशंस, अपने इलाकों के बारे में जो लिख के दिया हुआ है यहाँ पे, उसका जवाब हमने कोशिश की है कि उसका जवाब जो हम भेज दें, और वो जवाब जो है वो उनको मिल भी गया होगा। तो मुझे यकीन है कि वो इस जवाब से मुतमईन होंगे। अगर कुछ भी कमी रह गई हो तो वो मुझे फिर लिख के बाद में, ताकि मैं उस कमी को देख के ठीक कर सकूं। सर सबसे पहले मैं एजुकेशन के बारे में बात करूंगी, क्योंकि यहाँ सभी ऑनरेबल मेंबर्स बहुत तजुर्बेकार है, पढ़े लिखे हैं, जिन्होंने सजेशन जहाँ रखे हैं एजुकेशन डिपार्टमेंट के बारे में, मैं उनकी बहुत बहुत शुक्रगुजार हूँ। और इंशाल्लाह मैं कोशिश करूँगी उन सजेशंस को डिपार्टमेंट में इंक्लूड करके आगे चलने की। Sir, I am thankful to honorable members who have spoken about the various aspects of school education, higher education, health and medical education, and social welfare. The way they have highlighted the overall challenges in these sectors and the constituency-wise issues related to these sectors is really appreciable. Their suggestions about these sectors will definitely guide us in addressing the challenges and also improve where required. Sir, as you know that education and health are the most important sectors upon the foundation of a nation depends under the visionary leadership of late Sher Kashmir Sheikh Mohammed Abdullah. These sectors were given importance. I am thankful to Honorable Chief Minister who posed trust in me to head these important sectors. I am also thankful to him that despite all financial limitations, as Finance Minister, he has kept extraordinary budget provisions for education and health sectors. This budgetary support will help in improving and quality of education as well as health services. School education, Jammu and Kashmir has a distinct of having free education up to university level. There is a network of 18,724 government schools in which 13,84,000 students are enrolled. Besides, there are 15,517 private schools as well. This network of schools has helped Jammu and Kashmir to achieve literacy rate of 77.3%, which is very close to national literacy rate of 77.70%. In order to extend the benefits of quality education to the people of Jammu and Kashmir, a number of initiatives have been taken, which includes infrastructure, building human resources, development, pre-primary school, KGBS and girls hostels as well. Under UT Capex Samagra, an amount of rupees 739 crores has been approved for infrastructure development, which includes new buildings, additional school rooms, etc. In order to address the need for having suitable accommodation in government schools, additional classrooms are planned in 545. High and higher secondaries also, besides upgradation of infrastructure in various schools. In addition to this, 150 science computer labs are planned to be constructed in next financial year along with 100 school buildings for rented schools. Immediately after the present government took over, in its first cabinet meeting, the November session was restored on public demand for the large benefit of students and parents. I must thank all the stakeholders, including Jammu and Kashmir Board of School Education, for making it possible despite of time limitations. In order, the students with latest methods of education, ICT labs, adult drinking labs, and smart classrooms have been introduced, which is helping our students to compete at national and international level. During the current budget, a provision of 600 ICT labs, 2,000 smart classrooms and 1,500 ATLS has been kept to encourage innovation and scientific temperament among the students. Similarly, 15,000 pre-primary schools are to be established for the benefit of targeted enrollment of 1,80,000 children. In order to encourage mother tongue, various initiatives are being taken at the primary and upper primary levels. For direct benefit of the students, various facilities like textbooks, free uniform, midday meals and scholarships are being offered. This kind of facilities has helped the department in attracting more enrollment. Besides reducing the dropout, special enrollment drives are being conducted to attract more and more students in government schools and also ensure that no child remains out of school. For the benefit of students in remote areas and students belonging to migratory population, 1,859 seasonal centers are being run across Jammu and Kashmir. Due to these initiatives, the students in government schools have been doing very well as reflected in the board exams. During last year examinations, most of the 10 positions in all the streams have been achieved by students of government schools. इस पे कुछ नहीं कहेंगे, आप कहते हैं गवर्नमेंट स्कूल में कुछ नहीं होता है, लेकिन सबसे ज्यादा अगर कोई पोजीशन होल्डर निकलते हैं वो गवर्नमेंट स्कूल से निकलते हैं. Even in professional competitive exams, the pass out of government schools have done very well. For capacity building of teachers, diets are being upgraded and made as centers of excellence. Besides, the teachers are being deputed to obtain training in various centers at national level. Honorable Sir, most of members who spoke about education have highlighted the need of fulfilling the vacant positions at various levels. I want to apprise the House that a number of steps have been taken to fulfill the vacant posts under district and promotion quota. 22 principals promoted as COs, 122 lecturers promoted as principals, 80 headmasters promoted as ZDOs, 571 masters as headmasters, for which orders being issued shortly, 1,785 teachers promoted as masters, 2,000 vacant posts of lecturers in promotion quota are being filled up shortly. 594 posts of plus 2 lecturers have been referred to Jammu Kashmir Public Service Commission for selection in time-bound manner. For encouraging female literacy among SC/ST population, 89 KGBVS have been made operational. Besides, 85 girls' hostels have been sanctioned in educationally backward blocks. Under Beti Anmol scheme, more than 12,000 BPL girl students have covered, for which an amount of rupees 7 crore was spent. Some honorable members raised the demand for construction of new subjects. I want to apprise the House that a demand for introduction of new subjects has been received from various corners. And even I feel that we should introduce such subjects which will help our students in skill development and competing in open market The demand is under examination and a decision will be taken after taking into account all factors. However, for skill developmental vocational education has already been introduced in 1,315 schools benefiting 1.41 lakh 41,000 students through various traders. Some honorable members various trades. Some honorable members raised the issue of upgradation, decluttering of schools. Such demands have received from honorable MLAs as well as other co-authors. The demands are being examined as per norms, and wherever the demand fulfills criteria along with justification in terms of enrollment, same will be considered. The demand for framing of transfer policy of RATs is also under examination and decision will be taken after considering all aspects of the matter. सर एजुकेशन स्कूल एजुकेशन के बारे में और काफ़ी इश्यूज आए हैं जो सारे इश्यूज में यहाँ टच नहीं कर सकती हूँ, लेकिन जो रह गया होगा पॉइंट उसके बारे में मैं ज़रूर आपको रिटर्न में जो है जवाब भेज दूंगी। सर इसके बाद हेल्थ सेक्टर एक बहुत इम्पॉर्टेंट सेक्टर है और सबसे ज़्यादा इस वक्त अगर प्रॉब्लम है वो ये है कि वैकेंसीज बहुत ज़्यादा है। जहाँ 4 डॉक्टर चाहिए वहाँ 1 डॉक्टर अवेलेबल है, लेकिन हमने कोशिश की है जब से ये सरकार बनी उमर अब्दुल्ला साहब की क़ियादत में उन वैकेंसीज को जितना मुमकिन हो सका फिल करने की, लेकिन मैं ये भी नहीं कह सकती हूँ कि सारी वैकेंसीज जो हैं वो फिल हो गई है। अभी भी काफ़ी वैकेंसीज हैं जिनको फिल करना जो है बहुत ज़रूरी है। दूसरी यहाँ बहुत बड़ी डिमांड आई है न्यू ओपनिंग जो है डिस्ट्रिक्ट सब डिस्ट्रिक्ट PHC डिस्पेंसरीज के बारे में बहुत ज़्यादा ऑनरेबल MLAs ने इसके बारे में बात की हुई है। मैं आपको यकीन दिलाती हूँ कि जैसे करा साहब ने अपने तकरीर में कहा है कि अभी हमें कंसोलिडेशन पे ध्यान देना चाहिए। अभी बहुत ज़्यादा कहीं कहीं एरियाज़ में खस्ता हालत है इंफ्रास्ट्रक्चर की, और हम कोशिश करेंगे जितना जल्द हम इंफ्रास्ट्रक्चर ठीक कर सकते हैं उसके बाद हम अपग्रेडेशन पे जो है आगे बढ़ सकते हैं। हेल्थ डिपार्टमेंट्स के बारे में जो 4 महीनों की अचीवमेंट्स है उन्हीं पे बात करूंगी मैं ज़्यादा। मेजर अचीवमेंट्स ऑफ हेल्थ एंड मेडिकल एजुकेशन डिपार्टमेंट लास्ट 4 months। GMC Anantnag became the first among established medical colleges to have dedicated cath lab for South Kashmir. Similarly, cath lab is being made operational in GMC Jammu in a week's time. Necessary testing done besides permissions of Energy Regulator Board for operating relevant equipments obtained. 3 new cath labs will be established, one each in North, Pir Panchal and Chenab Valley, with a budgetary provision of 45 crores. Approval of state-of-the-art surgical theatre block at SMHS Hospital Srinagar, 50.24 crore. This project of emergency theatre block at SMHS Hospital shall enhance emergency surgical care in the golden hour in the large interest of the public at large. Chobra Nursing Home at GMC Jammu started services with state-of-the-art machinery to provide affordable and quality health care services to the people of Jammu. Government Homeopathic Medical College Katwa started its first batch of BHMS students, 63 students from makeshift arrangements at GMC Katwa. The construction of the own building of Government Homeopathic Medical College at Rakhi Hoshari shall be taken up in financial year 2025-2026 at a cost of 52 crore under National Ayush Mission, 90-10 sharing pattern. Process initiated 250 bedded Maternal and Child Care Hospital be established at cost of rupees 86 crore at Janglat Mandi, Anantnag. 12 to 18 ambulance services benefited patients through a network of 489 ambulances. 44 more advanced life support ALS ambulances are also being added to the existing in 15 days. For reducing TB under 100-day TB elimination campaign, approximately 90%, 5,78,184 individuals of the vulnerable population in priority districts including Jammu, Samba, Katwa, Srinagar and Baramulla were screened. The campaign also achieved notable milestones including organizing 88,479 awareness camps, conducting 88,513 and supporting 7,293 notified TB patients, marking significant process towards TB elimination. Under National Quality Assurance Standard, a total 92 families have achieved certifications ending February 2024, 69 certified since January 2025. With 38 facilities achieved national certification and 54 facilities state certified in the UT of Jammu and Kashmir. Additionally, 20 more facilities are under process of the district assessment and certification. Additional 100 facilities targeted in the year of 2005-2006 for certification under NQAS. 3-tier faculty structure implemented in Government Dental College, Jammu and Srinagar. Major focus of budget includes number 1, enhancement of services in tertiary care in GMCs. To enhance medical facilities, Government Medical College, 3 new cath labs will be established, 1 each in North Kashmir, Pir Panjal, Chenab Valley with a budgetary provision 45 crore. LINAC will be installed at the State Cancer Institute, GMC Jammu and Sikkim Srinagar to enhance cancer diagnosis and treatment in financial year 2025-2006. Over the next 3 years, MRI services will be made available in all new government medical colleges. PET scan will be introduced in GMC Srinagar. Besides 7 crore each for GMC Jammu and GMC Srinagar for the creation of emergency medicine departments over a 3-year period. An additional 10 crore has been allocated to Sikkim along with the completion of 200 bedded IPD facility at Sikkim's Medical College, Bimna. To strengthen medical research and emergency services, 10 crore has been proposed for research in medical education over the next 2 years. इसके बारे में वीरी साहब आप बात कर रहे थे, पता नहीं कहाँ लिख रहे हैं. इसके लिए पहली बार जो है जम्मू कश्मीर में 10 करोड़ रुपया जो है मुकर्रर किया गया है ताकि आप रिसर्च कर सकें. जैसे आपने कैंसर के बारे में बात की है, और भी कुछ डिजीजेज हैं जो आइडेंटिफाई नहीं हो पाती हैं कि क्या रीज़न है, उसके लिए ये 10 करोड़ जो है वो इस बार पहली बार रखा गया है. एडिशनल एसोसिएटेड हॉस्पिटल्स फॉर न्यू GMCs. Modalities in consultation with NMC to designate facilities like District Hospital Kulgam, Targami Sab, SDH Sopor, SDH Paroli, SDH Hiranagar and others as associated hospitals of respective new GMCs for improving services facilities in these areas. Additional UG PG seats to enhance bed capacity. Delhi ICUs being established in 7 GMCs on hub and spoke model round the clock specialist services to the patients. Enhancement of services, diagnostic and patient care at secondary levels. The services of district and sub-district hospitals will be enhanced by way of CT scan services to be fully implemented in all district hospitals of Jammu and Kashmir. Improvement of dialysis services, expansion of dialysis centers at all 83 SDHs, CHCs over the next 2 years, within an additional 16.80 crores allocated for 40 SDHs, CHCs in the next financial year, to achieve TB-free status and also enable early detection and screening of elements at grassroots level. 100 portable AI-based X-ray machines will be provided to district and sub-district hospitals over the next 2 years, with 16.50 crore allocated in 50 units in 2025-6. Infrastructure strengthening for critical care and diagnostics at all levels, bringing critical linkages. Under PM ABIM, 13 critical care blocks, 111 block public health units and 10 district public health laboratories shall be substantially completed. We shall improve bed capacity for critical care to hand besides diagnostic facilities. Recognizing telemedicine as a solution to our geographical challenges, the government aims to integrate telemedicine services across various medical facilities. Improving healthcare accessibility infrastructure will be strengthened to support seamless teleconsultations and remote monitoring, ensuring efficient and adorable healthcare for all residents. The upcoming BPHUS shall also be leveraged for teleconsultation services. Strengthening of telemedicine services is Sanjeevani in 100 BPHUS coming up under PM ABIM. Financial implication 10 crore. Under SAHEP initiative, all residents receive free health insurance of 5 lakh per family. With 86.43 lakh golden cards issued and 251 hospitals implemented, the government is ensuring quality health care accesses. So far, over 9.36 lakh patients have received 15.85 lakh, amounting to nearly 2.869 crores free of cost. Moving forward, implementation gaps will be addressed to enhance efficiency. SAHEP app is being launched to improve healthcare delivery system, bringing services providers and patient under one digital platform. Manpower availability, a way forward to improving accesses to healthcare. Jammu and Kashmir working on 71% availability of doctors against the sanctioned posts. However, additional set of doctors, paramedics, others is supplemented through National Health Mission. Besides 1,430 doctors, come specialists, MO, Ayush are supplementing to improve the services. 68% paramedical available in Jammu and Kashmir with additional support of 8,780 paramedics rendered through NHM. A total number of 10,866 employees have been engaged on contractual basis under NHM for improving service health delivery in rural areas. Besides, 13,783 ASHAs are in position to assist in implementation of various schemes programs. There is a bit of gap in availability of manpower. Settle efforts to minimize this gap. Way forward for filling up vacant posts or as under. Fast-track recruitments through the referrals of vacancies and operationalization of waiting lists. The department has conceptualized to concept the rural health bond for mandatory serving in rural areas for 2 years for coming in government services for doctors pursuing UG, PG for government institutions. Other initiatives to address shortage of manpower, digital interventions in the shape of telemedicine, e-Sanjeevani, teleradiology to be expanded, DRP to be strengthened and expanded. Tele-ICUs are being rolled out in new GMCs. Ambulance services are being enhanced under 102, 108 network with addition of 44 ambulances, taking the total tally to 530. Rationalization process of manpower for critical gap analysis and bridging through a comprehensive strategy. The challenge is bigger in Jammu division with regard to doctors availability in districts like Poonch, Riyasi, Kashtawar, Doda, Katwa, Udhampur and Kupwara district in Kashmir. Jammu and Kashmir is among us the front runner in health indicators. Health institution density and bed population ratio. Facility level gaps exist, especially with regard to manpower issues, particularly, which is a challenge, and the government committed to promote strategy to address the gaps in a phased manner. As of now, Jammu Kashmir is working on consolidation, strengthening of existing health facilities, as around 4,000 health institutions at various levels, primary, secondary and tertiary exists. The focus of the government shall be on completion of ongoing projects. Jammu and Kashmir is among top runners amongst the largest state cities with population more than 1 crore in health institution density in the country. The calculations worked as per report published in 2003. Government of India indicates that Jammu and Kashmir has an health institution every 35 souls against an average 6,000 souls at national level. States like Kerala, Madhya Pradesh, Punjab, Uttar Pradesh, Chandigarh, Delhi have a health facility at 5,000, 6,000, 7,600, 8,000, 23,000, 30,000 souls respectively. There is a continuous demand for honorable MLAs for creation, upgradation, which involves a huge cost and amount of manpower and can only look into after analysis of the existing facility available. Vicinity in a holistic manner as per the IPHS norms 2022 for the optimal utilization of the resources. Critical gaps wherever found shall be looked into case-to-case basis for arranging augmenting health services. To mention that Jammu and Kashmir around 20,000 medical beds existing, which accounts for the ratio of 1 bed for every 700 population. In addition, 5,000 beds are likely to be added within a couple of years with operationalization of AIMS Kashmir, AIMS Jammu projects under PM Abim, completion of teaching district hospitals of new government medical colleges, SDA, CSCs, etc. of UT sector, which shall help to achieve the target of national health policy. Ongoing initiatives, projects in pipeline. Work on AIMS Kashmir going at a fast and is targeted to be completed by November 2025. Additional block at Bone and Joint Hospital Srinagar, 443 bedded labor block at SMHS Hospital Jammu, 250 bedded MCCH for Anantnag, GMC Udhampur targeted completion July 2025. GMC Hindwara after finalization of site in consultation with Agriculture Department, extension of timelines from the Government of India up to 27. 152 bedded district hospitals at Rishipura, Badgam, 18 months completion for time now. Construction of 100 bedded MCH, Rajouri, 18 months completion time from now. 16 critical care blocks, 50 bedded, 1400 bedded, 2. The details are as under. GMC Baramulla, Anantnag, DH Badgam, 100 bedded, Kulgam, Shupayan, Pulwama, Ganderbal, Sikkims, Bemna, CHC Kopwara. CHC Rajouri, Katwa, Doda, Chest Disease Hospital of GMC Jammu, 100 bedded, DH Punch, Riyasi, Udhampur. Works under progress except GMC Udhampur. Work awarded at GMC Doda. Work awarded. Timelines March 2026. इसके अलावा ऑनरेबल मुबारक गुल साहब ने और सलमान सागर साहब ने बात की थी कि करा साहब ने लावेपुरा और इनके एरिया में जो हॉस्पिटल हैं जो शायद सिक्योरिटी फोर्सेस ने इस वक्त लिया हुआ है, तो डिपार्टमेंट ने ऑलरेडी उनके साथ एक टेकअप किया हुआ है। कोशिश करेंगे कि जितना जल्दी हो सके इसको वैकेट करवाने की। अगर नहीं पॉसिबल हुआ तो उसके अलावा फिर कोई और लैंड जो है उसको आइडेंटिफाई किया जाएगा ताकि जहां पे हॉस्पिटल बन सके। सर, सोशल वेलफेयर डिपार्टमेंट is the foundation and progressive society. Our government is committed to uplifting the most vulnerable, ensuring dignity, security, equal opportunities for all. Welfare initiatives, we empower the elderly, widows, special abled individuals, women, children and marginalized communities, reinforcing our pledge to the social justice. Social welfare department operates through Mission Poshan, Vatsalya, Shakti, with the directorates of Jammu and Kashmir focusing on pension, scholarships, welfare schemes and elderly disabled. Commissioner Rehabilitation Council CRC provide comprehensive support for persons with disability. Additional financial assistance for income generation is extended. Women Development Corporation, I am honored to present the key achievements and future roadmap of the department. Ensuring financial security and dignity of our. During the budget 2005-26, Honorable Chief Minister in charge Finance Department was pleased to announce revision in pension amount across the beneficiary categories. All beneficiaries under both NSAP and ISSS received a uniform pension rupees 1,000 per month. To promote equity and sustainability, structure has been introduced to enhance pension amounts with beneficiaries age groups the new pension structure. These initiatives reflect our commitment to social justice. Education is the foundation of progress and our government remains committed to ensure that no child is deprived for learning due to financial constraints. As a step towards social justice, we are implementing affirmative action measures to support students from disadvantaged communities. 2024 scholarships were provided to 9,668 SC students and 2025 we are expanding coverage to 13,000 students. The scholarship coverage, tuition fees, maintenance allowance, hostel support, help educational disparities and promote inclusive development. A key initiative under affirmative action effort is to PM Achievers Scholarship Award Scheme for Vibrant India OBC, EBC, DND students after non-operational for 3 years. Under the ICD program Mission Poshan in our union territory, we are committed and ensuring the well-being of children, adolescent girls, pregnant women and lactating mothers through the growth monitoring technology solutions like Poshan Tracker and awareness initiatives such as Poshan. 28,185 Anganwadi centers have fully adopted the Poshan Tracker, ensuring transparency of 8,99,000 Aadhaar authenticated beneficiaries receiving supplementary nutrition. 99% Anganwadis are going tagged and equipped with electricity, safe drinking water and toilets. 2,120 Sanganis and 2,852 Sakhis have been engaged to strengthen grassroots services delivery. 50,929 anemia camps conducted, benefiting 16,350 anemic individuals. 136 Anganwadi centers district converted into Saksham Anganwadi centers. 222 upgraded with infrastructure improvements. 208 Anganwadi centers upgraded into Bal Vikas for historic early childhood education. 445 targeted for transformation this year with 69 completed. Anganwadi centers with drinking water 98.79% national, 88.81%. Anganwadi centers with functional toilets 98.60% national, 71.97%. Children 6 months to 6 years receiving supplementary nutrition program 76.38% national, 39.15%. Pregnant lactating mother women receiving SNP 71.117% national, 55.16%. Children with low birth weight lost 6 months 22.17% national, 2.25%. Positions filled Anganwadi workers 96.17%. Under one stop center, OSCs have been operationalized in all districts. 11,782 women assisted to OSCs with counseling, police aid and legal support. 954 women provided shelter. Women Helpline 181, Child Helpline and Emergency Response Support System have effectively addressed 37,298. Nari Adalat initiatives in Baramulla and Kupwara has successfully conducted 599 meetings at the Panchayat level to resolve grievances, community solutions. Our commitment to safe housing is reflected to Shakti's southern facilities in Kupwara and Jammu, which currently houses 45 women in distress. 11 more facilities are planned in Anantnag, Bandipora, Badgam, Doda, Jammu, Katwa, Pulwama, Riyasi, Ramband, Punch. During 2025, 4 to 2025, 25,900 families have been assisted in the marriage of their daughters. Since 2015, marriage assistance scheme supported 1,14,899 families with a financial contribution of rupees 5 to 6.1 crores under the लाडली बेटी स्कीम. यहाँ पे एक ऑनरेबल एमएलए साहब ने, शायद महराज साहब ने कहा है कि ऑनरेबल जो लाडली बेटी स्कीम है ये सिर्फ कुछ डिस्ट्रिक्टों में है, लेकिन मैं सर बताना चाहूँगी कि लाडली बेटी स्कीम जो है अभी सिर्फ 8 डिस्ट्रिक्ट्स में इंट्रोड्यूस हुई है. बाकी डिस्ट्रिक्टों के लिए हमने लिखा है लेकिन अभी तक क्लियरेंस नहीं आई है. जब आएगी तो उसमें आपका डिस्ट्रिक्ट जो है उसको भी कंसिडर किया जाएगा. बांडीपोरा का भी देखा जाएगा. Under the sponsorship program of Mission Vatsalya, 5,000 children in Jammu and Kashmir have been provided financial assistance of rupees 4,000 per month to ensure they receive necessary education, nutrition and health care. Further, our government has concrete steps to create child-friendly environment. 20 juvenile justice boards and 20 child welfare committees constituted for rehabilitation and welfare of children in need of care and protection, as well as those in conflict with the law. Financial year 2025, we have reached out 20,983 children initiatives under Mission Vatsalya. 1,154 children in 52 government-run homes. 83 children 12 specialized adoption agencies. 594 children supported in observation homes. 5,944 children through juvenile justice boards. 4,880 children supported child welfare boards. 5,684 children benefited under sponsorship program of the child in special situation schemes. 587 children placed in shelter homes. 399 children received continued support under after-care services. 69,252 children have benefited from services under Mission Poshan, bringing the total coverage of children under various social welfare programs. 7,90,235. We are taking sufficient steps to enhance child protection infrastructure across Jammu and Kashmir. 2 Vatsalya Sadans are being constructed in Ramban, Kupwara, and addition 2 Vatsalya Sadans already under construction of Jammu and Badgaon. 44 child line have being established in 16 railway stations and 28 bus standards across Jammu and Kashmir. Financial assistance for protection of child sexual offence cases has been approved with the ministry sanction ₹10 lakh per district of Jammu and Kashmir. Department of Social Welfare is the process of establishing Juvenile Justice Fund as mandated under Section 105 of the Juvenile Justice Act to ensure long-term support for juvenile justice initiatives. During the financial year, we are proposing to cover 6,000 children in need of care protection in non-institutional segments. 6,000. Direct scheme is implemented. Direct financing scheme, NFDFC, concessional loans for minority women entrepreneurs. NFDC, small loans for group-based micro educational loan scheme, low interest financial of higher education in India and abroad. NFCFDC, credit loan support for backward class women to start ventures. Microcredit loan, term loan scheme, women entrepreneurship program. Key concessional loans at 6% interest, education loans at 3% interest. 1,848 units financed ₹30.25 crores, disbursed 6,668, jobs created. 1,409 units approved, ₹39.3 crores, sanctioned ₹1.88 crore, disbursed benefiting 2,933 individuals. ड्रग एडिक्शन के बारे में यहाँ सोशल वेलफेयर में भी और हेल्थ डिपार्टमेंट में भी, इसमें सोशल वेलफेयर डिपार्टमेंट जो नशा मुफ्त अभियान जो है चलाया जा रहा है उससे काफ़ी हद तक फ़ायदा हुआ। मैं बताना चाहूँगी 80,36,639 youth and 9,24,271 women have been directly engaged in drug awareness programs. 80,830 activities have been conducted covering 20,596 educational institutions. 3 drug de-addiction centers operationalized in Rajouri, Kulgam, Bandipora, 4 additional centers in pipeline in Samba, Udhampur, Riyasi and Ramban. Capacity building programs to train teachers, healthcare professionals and law enforcement personnel. A drug-free Jammu and Kashmir is not just a vision, it is a commitment that we must fulfill for our future generation. सर अभी हायर एजुकेशन के बारे में भी है, कॉलेजेस के बारे में, क्योंकि कॉलेजेस के बारे में यहाँ बहुत सारी बातें हुई हैं। उसके बारे में थोड़ा सा कुछ जिक्र करूंगी मैं हायर एजुकेशन के बारे में। यही मुश्किल है, आप लोग सुनाना तो बहुत कुछ चाहते हैं लेकिन सुनने की जब बारी आती है तब आप सुनना नहीं चाहते, ये सबसे बड़ी मुश्किल है। सर हायर एजुकेशन के बारे में भी काफ़ी कुछ, ऐसे यूनिवर्सिटीज़ हों, कॉलेजेस। 3 बजे
वोट लेना है।
जी 3 बजे तक मैं,
उससे पहले आप खत्म करें, 2-3 मिनट मुझे और चाहिए।
सर एट प्रेजेंट देयर आर 142 गवर्नमेंट डिग्री कॉलेजेस आउट of the total 142 colleges, 5 were sanctioned during 1920. The detail of these 5 new sanctioned colleges as under. College building completed as on date 7 number college buildings where construction is going on 19 number. 8 number of the college buildings are expected to be completed soon. College buildings where construction would be initiated 19 numbers in 2005-2006. Colleges having land issues, land not available, कोटरंका, लोचीबाग एंड रामगढ़। क्योंकि बहुत सारे एमएलएज ने बात की है कि कॉलेजेस क्यों नहीं बन रहे हैं, क्योंकि इनमें काफ़ी ज़्यादा जो है कहीं कहीं लैंड डिस्प्यूट है। अगर पैसा रिलीज भी दिया गया है लेकिन लैंड डिस्प्यूट की वजह से ये कॉलेज जो है कंप्लीट नहीं हो पाए। कॉलेजेस हैविंग कोर्ट केसेस, इसमें से 2 हैं जिनके ऊपर कोर्ट केस है। एक है सिलीगाम अशमुकाम पांचहरी कॉलेज। ये अल्ताफ साहब जो ऑनरेबल एमएलए साहब हैं ये बार बार बात करते हैं अशमुकाम कॉलेज के बारे में, क्योंकि बहुत पहले जो है शायद 15 या 18 में जो है अशमुकाम के लिए मतलब पहलगाम कंस्टिट्यूंसी के लिए कॉलेज सैंक्शन किया गया है, जिसपे फिर 2 गांवों के बीच में काफ़ी डिस्प्यूट हुआ है और वो सब जुडिस हो गया है। अब ये कोर्ट में है इस टाइम, फिर अशमुकाम के लिए कहा गया है लेकिन अभी फैसला नहीं हुआ है। ये कोर्ट डिसीजन अब आएगा तो मैं ऑनरेबल मेंबर अल्ताफ साहब को यकीन दिलाना चाहूँगी कि कोर्ट डिसीजन आएगा तो इंशाल्लाह जो भी कोर्ट का डिसीजन होगा उसके मुताबिक जो है हम उसको इम्प्लीमेंट करेंगे। 3 फंक्शनल इंजीनियरिंग कॉलेजेस हैं, GCET जम्मू, GCET सफा, हाँ बता दिया मैंने, उसका भी कोई लैंड डिस्प्यूट है। UIAT कठवा। फर्दर 1 इंजीनियरिंग कॉलेज इज अंडर कंस्ट्रक्शन एट पुंछ अंडर CSSS रूसा के अंडर है ये कॉलेज। देयर आर 2 कॉलेजेस कोट बिलवाल जम्मू, गांधरबल सफापुरा। द बिल्डिंग्स ऑफ बोथ schools is under architecture colleges है under construction and presently they are functioning from GCETS. There are 22 government colleges of education, one at Canal Road Jammu and another one at MA Road Srinagar. There are 202 private colleges, 14 bed colleges, 7 engineering colleges, 10 law colleges and 43 degree colleges. सर मुझे पता है टाइम कम है लेकिन 1-2 इश्यूज हैं जो यहाँ पे आए। एक आया था आंगनवाड़ी हेल्पर्स के बारे में। बहुत सारे ऑनरेबल एमएलएज ने अपना कंसर्न दिखाया था इसमें कि ये जो हेल्पर्स लगते हैं ये पहले लगते थे, बिल्कुल कोई क्वालिफिकेशन बार नहीं था, लेकिन अब जो रिसेंटली 1 साल पहले ऑर्डर आया है उसमें एक क्वालिफिकेशन बार रखा गया है कि अंडर मैट्रिक होना चाहिए जो हेल्पर होगा। सर उसमें मैं मानती हूँ ऑनरेबल एमएलए का कंसर्न जो है बहुत जेन्युइन है, क्योंकि बहुत इश्यूज आते हैं, कोर्ट केसेस हो जाते हैं। हेल्पर के लिए कोई क्वालिफाइड मैट्रिक पास हो या अंडर मैट्रिक हो आने के लिए तैयार नहीं है। मैं ऑनरेबल एमएलए को यकीन दिलाना चाहूँगी इसको ज़रूर एग्जामिन करेंगे, फिर इसको तो कैबिनेट में लेना है। ऑनरेबल चीफ मिनिस्टर साहब यहाँ बैठे हुए हैं, फिर जो कैबिनेट का फैसला होगा, जो डिसीजन होगा वो इसमें देखा जाएगा। यहाँ पे एक ऑनरेबल मेंबर साहब ने बात की थी कि डिस्क्रिमिनेशन। मैं यहाँ पे बताना चाहूँगी कि हमारा रोल नहीं है कि हम कहीं पे डिस्क्रिमिनेशन करें। अगर आप पीछे भी जाएं देखें, जब भी गवर्नमेंट आई, चाहे वो फारूक अब्दुल्ला साहब की गवर्नमेंट हो, चाहे वो उमर अब्दुल्ला साहब की गवर्नमेंट हो, जितना भी शेयर जिसको मिलना है कभी ज्यादती नहीं हुई। और आज मैं फिर यहाँ पे ऑनरेबल हाउस को यकीन दिलाना चाहती हूँ, जो जम्मू का हक है वो जम्मू को मिलेगा, जो कश्मीर का हक है वो कश्मीर को मिलेगा। किसी के साथ डिस्क्रिमिनेशन नहीं होगी, किसी के साथ ज्यादती नहीं होगी, ये सवाल ही नहीं पैदा हो सकता है। इसलिए आप इसमें कोई फिक्र करने की। और दूसरा, ये जो आपने यहाँ पे कुछ फिगर्स बताए हैं, ये जब रिक्विजिशन आती है वहां से, फॉर एग्जाम्पल के कोई हॉस्पिटल कंस्ट्रक्ट होता है, वहां से ये रिक्वेशन आती है कि फलानी हॉस्पिटल के लिए हमें इतनी फंडिंग चाहिए, और डिपार्टमेंट कभी ये नहीं चाहेगा कि अगर यहाँ का HOD, यहाँ का कंसर्न डायरेक्टर पैसा मांगेगा और डिपार्टमेंट उसको बंद करेगा, पॉसिबल ही नहीं है। जितनी भी रिक्वेजिशन आई है उसके मुताबिक पैसा दिया गया है, और उसके मुताबिक अगर आप यहाँ पे बात करेंगे, मुझे लगता है कि सबसे ज्यादा पैसा जो है वो जम्मू में लगाया गया। लगाना चाहिए, मैं नहीं कहती कि क्यों लगाया गया, जहां पे भी जरूरत हो, जम्मू में जरूरत हो, कश्मीर में जरूरत हो, वहां पे पैसा लगना चाहिए। आप ये खदशा अपने दिल से निकाल दीजिए। सर, मैं ऑनरेबल मेंबर्स से गुजारिश करूंगी जिन्होंने कट मोशन लाए हुए हैं, उनको जवाब मिल गया होगा। मेरी मतबाना गुजारिश कि अपने कट मोशन जो है वापस लीजिए। और एक कंसर्न था सजाद गनी लोन साहब का, वो अभी हाउस में नहीं है। कुछ मेंबरों की आदत है अपनी तकरीर तो सुनाते हैं, उसके बाद चले जाते हैं, फिर सुनने की हिम्मत नहीं होती उनके पास कि हम भी कुछ सुने। लेकिन उन्होंने रिजर्वेशन का इशू यहाँ पे उठाया है, जो बहुत जेन्युइन इशू है, उसके बारे में उन्होंने बात की है। लेकिन ऑनरेबल चीफ मिनिस्टर साहब ने पहले ही एक कमेटी जो है वो रिजर्वेशन के बारे में तश्कील दी हुई है, और मैं उनको यकीन दिलाना चाहती हूँ, क्योंकि ये बहुत सेंसिटिव इशू है और ये कोई आसान काम नहीं है। पूरा जो है इसको एग्जामिन करना पड़ेगा, देखना पड़ेगा, हर एक सेक्टर को जो है सुनना पड़ेगा। उनकी रिप्रेजेंटेशन ऑलरेडी आ चुकी है, हम कर रहे हैं एग्जामिन, और इंशाल्लाह जो कमेटी बनी है वो जब अपना रिपोर्ट देगी तब सजाद साहब को भी उसमें इन्फॉर्म किया जाएगा। सर, मैं फिर आप सबकी बहुत शुक्रगुजार हूँ कि लगभग 1 घंटे तक आपने मुझे सुना, उसके लिए बहुत बहुत शुक्रिया। और मैं यही उम्मीद करूंगी कि आगे भी इसी तरह आप अपने सजेशन देते रहें, और हम यहाँ पे काम करने के लिए हैं, सुधार